Good afternoon. I'm Roxana Gapster, President and CEO here at WellSpan. Welcome to WellSpan York Hospital. Thank you all for coming today, and welcome home, Governor Wolf. We are so proud that you and WellSpan call York County home. We're honored to have you here to celebrate and recognize the incredible work and dedication of our 20,000 WellSpan Health team members, including 5,000 physicians, nurses, and other team members right here on this campus. I'm thrilled to see that many of them have joined us here today to hear firsthand how much they are appreciated, especially in this heat. They are really the heart of WellSpan and truly our healthcare heroes. And our commitment to them is as strong as their commitment to our communities has been through this pandemic. Throughout the pandemic, our dedicated team members have placed patients first, providing expert and compassionate care to our friends and neighbors. As we've resumed services at our over 200 locations across our 6-county region, WellSpan care teams are providing safe, high-quality care for all their friends and neighbors. The health and safety of our team members remains our #1 priority. That's why we've added new policies and enhanced safety protocols, including visitor restrictions, mandating masks, ensuring social distancing, and new rigorous cleaning policies. When you see our physicians, nurses, environmental, and food service workers wearing masks, they're wearing them to protect their patients and each other. That's why we ask our patients and visitors to extend the same courtesy when they're with us, because everyone's health is important and everyone deserves to be protected. We also encourage our friends and neighbors to seek health care when they need it. Don't delay, especially for emergencies and chronic conditions. We're here for you where and when you need us. In addition, I'd like to thank Governor Wolf, Secretary Levine, and their teams for the partnership during this pandemic. At WellSpan, we take seriously our role as a trusted partner, and through the partnership we have with local, state, and federal leaders, we're reimagining healthcare together. One example is the thank you that we want to give Governor Wolf and Secretary Levine for providing us with regulatory flexibility during the pandemic to protect and save lives during this extraordinary time. Thanks also to Governor Wolf for recently signing legislation to enact stronger protections for our care team members while in the workplace. These bills were sponsored by Senator Kristen Phillips-Hill and Judy Ward and supported by Representative Keith Gillespie, and we greatly appreciate their bipartisan efforts to support Pennsylvania's healthcare heroes. At WellSpan, we believe in the power of asking what if and cultivating a culture of curiosity. With the help of Governor Wolf and Secretary Levine and all of our elected officials and community partners, we're working toward that goal and looking forward to continuing to work together, serving as catalysts to conquer both the pandemic and the healthcare challenges of our communities. Governor Wolf, welcome and thank you.
Thank you, Roxanne, and you're right. We have this shared York County heritage. I was actually born right over here. My 2 daughters were born here, so this place means a lot to me, and I thank you for inviting me to come back. I have really 2 purposes today, and they are to first say thank you to the healthcare workers. I mean, when my daughters were born, when I've been here, when my parents were here, I recognized how important all the frontline healthcare workers actually are, what they mean to each of our lives, certainly to mine. But I think all of us have a greater appreciation than ever before about how important the frontline healthcare workers are. They have done what they always do, and they've done it, and they always did it very, very quietly, as they still are. But they're out there on those front lines. They're putting their lives at risk. This is a very, very contagious disease. It's an infectious disease. And as tough as the things they deal with day in, day out, this is probably as tough as anything. And so I think we owe them all a great debt of gratitude. And I want to include, obviously, the frontline workers, the nurses, the physician assistants, the doctors, but also the medical assistants, the radiologists, the phlebotomists, the therapists, the records clerks, the cafeteria workers, the administrative staff, the engineers, the IT staff, and the cleaning crews. I'm sure I've forgotten somebody, but you think about all the people it takes working on the front line to make a place like this work for all of us. It really is impressive. And this has been a really big challenge for everybody, most of all them. They've done incredible work in ensuring that local residents like me stay safe and that we have a safe place to go, including when we need treatment for things other than COVID-19. This place is open. As you know, York County has had 2,000 confirmed cases of COVID-19. And more than 70 people have died in York County from COVID-19, from this pandemic. That's 70 families who are never going to see a loved one again. 70. Many other COVID-19 patients are coping with long-term effects of this disease. I mean, anybody who says this is something that we ought to just maybe dismiss, they're wrong. There are people who have problems with irreversible lung damage as a result of having had this disease. There are people, in fact, the University of Miami says 30% of the people who have this disease can figure they're going to have long-term kidney problems. There are people who have had this disease who have heart and cardiovascular problems, GI tract issues, neurological issues, all kinds of things that you buy when you get this disease. And that's why I'm here, and Dr. Levine is here, and all of us are here to say there is one thing that we all can do. 13 million Pennsylvanians. I mean, we're dealing with an upsurge right now, but there's something that we can do to address that, and that is wear masks. When you wear a mask, you're protecting someone else. You're protecting the people around you, not yourself. It's a selfless thing to do. It's a thing that we ought to do to keep our neighbors safe, our family members safe, our friends safe, our co-workers safe. Study after, and I'm really reluctant to say studies show, but they do, that you're going to hear more from a York College professor who will reinforce that. But just wearing a mask, a simple gesture of wearing a mask actually makes a big difference. We can stop this disease. We can go back to where we were, which was one of the bright spots in the United States. I think we were one of 3 states that had gone 42 straight days with decline in new cases. We can get back there. We're still doing okay, but we need to act decisively, and we need to act together to make sure that we're doing everything we can for the people around us, for our fellow citizens. So please wear a mask. So I'm joined today, and you're going to be hearing from the City of York Medical Director Matthew Howie, Dr. Howie, also the professor from York College of Biology and Virology, Dr. Maida Higa, and of course Christina Hansen, a WellSpan hospital nurse. And before that, I'm proud to turn over to my co-worker, Secretary of Health, Commonwealth of Pennsylvania, Dr. Rachel Levine. Dr. Levine.
Good afternoon. Thank you so much, Governor Wolf. And I'd like to thank WellSpan York Hospital for having me here today. I would like to echo the Governor's sincere thanks to all of the frontline workers who continue to persevere against COVID-19. Your tireless, heroic efforts have not gone unnoticed during this pandemic. And we, as Pennsylvanians, must continue to do our part to protect ourselves and protect our loved ones from this virus. Now, as of 12 a.m. this morning, we have 1,027 new cases of COVID-19, and this brings our statewide total to 102,765 Pennsylvanians who have tested positive for COVID-19 in all 67 counties of Pennsylvania. and tragically 7,038 deaths have been attributed to COVID-19. As we now continue to see a rise in cases, the statewide mitigation efforts that were put in place last week to ensure that Pennsylvania does not see the number of COVID-19 cases return to the levels that we saw in the spring months, such as in April. We simply cannot allow the Commonwealth to take steps backwards and overwhelm the healthcare systems like this one. Unfortunately, every region of the state has counties that have seen a 7-day average rate of cases increase. And while the recent outbreak started in southwestern Pennsylvania, in Allegheny County, we now have seen counties across the state experience concerning rises in the number of cases of COVID-19. Now, individuals that test positive for COVID-19 must isolate. And through case investigations, we know that much of this is attributed to spread at locations where people aren't necessarily wearing a mask and social distancing is not occurring. And that includes bars, restaurants, and nightclubs. And that is why we took the mitigation efforts statewide that the governor did and I did last week. The next step after the case investigations is contact tracing. And that is the process of identifying, notifying, and monitoring anyone who came into close contact with an individual who tested positive for COVID-19 while they were infectious. So think about that a minute. I mean, how many people were you within 6 feet of for more than 10 minutes in the last 2 days or more? If you were to test positive for COVID-19, those individuals are now your close contacts. All those close contacts have a higher risk of getting COVID-19, and they must quarantine for 2 weeks. So as we visit the grocery store, the pharmacy, visit friends and family, no one is immune to this virus. And we know, as the governor mentioned, that wearing a mask, social distancing, washing our hands, like those steps, can stop this deadly virus from spreading to individuals we might see or be close to in a grocery store, to your loved ones, to your family. And so you can see that case investigations and contact tracing is always a critical part and key strategy to our process of reopening Pennsylvania, and an important tool to further mitigate the spread of COVID-19. Now, in addition to our great medical providers, I would also like to thank the public health staff, who are really the backbone of this contact tracing. These individuals are community health nurses, local, municipal, and county health departments, like the York City Health Bureau, and other committed volunteers. Pennsylvanians can show how much they appreciate those working on the front lines, like the medical workers here, and the contact tracers, by making the right choice to wear a mask when in public to protect yourselves. It's one of the easiest things that we can do to help stop the spread of this virus. So thank you again to Governor Wolf and WellSpan York Hospital. I'd like to leave you with a quote. This quote is actually in a news article that was recently published, quoting Dr. Deborah Birx at the White House Task Force. And she said, "What would happen if there was 100% mask use in public areas? Closing bars and limited indoor gatherings and decreasing dining capacity." This is her quote. When we modeled it, it came very close to the impacts of sheltering in place. So that's exactly the programs that we have here in Pennsylvania, but we need to continue to increase our mask uses. So if you're thinking, gee, should I wear a mask? Please wear the mask. If you're in a store where people might not be following the mandatory order, make a choice to leave that store. If you're getting together with people and they're not wearing a mask, then make a choice not to see those people. As much as our efforts about laws and mandates for safety, they're really about choices, your choices, the choices of the people in Pennsylvania. And by making the right choices, we know that our containment efforts and our mitigation efforts will benefit our health systems, benefit public health for everyone in Pennsylvania. So please, stay calm, stay alert, and stay safe. Thank you. And now I'd like to introduce Dr. Howie, who's the director of the York Bureau of Health and a physician at WellSpan. Dr. Howie.
Good afternoon. Thank you for the opportunity to speak briefly today, given this hot day. I'm a person who likes to educate. I kind of worked at different times as an attending at the residency here as part of my work. And with that, doctors are famous for quoting numbers. Well, some of the numbers have already been put out here today. But I just want to leave you with a couple of numbers and a story. And hopefully that'll be enough to kind of make the point when it comes to the work of public health. As mentioned, 100,000. We have more than 100,000 cases of confirmed COVID in our Commonwealth since the beginning of this epidemic 6 months ago. The first confirmed case was, believe it or not, 6 months, almost to the day today. 7,000. And that's a number we're talking about, the number of individuals who have died in the Commonwealth that we've attributed to COVID-19. Early on, I know there was discussions and comparisons of COVID-19 with this is just a bad influenza. Well, we've long since passed a bad influenza here, and it's continuing, and it's becoming a challenge to manage. We did make some very good early headway. We were seeing improvements in numbers, and I'm a daily number watcher. But the challenge is now maintaining those gains and trying to improve upon them. The last number I'm going to quote here is 72, and that's the number of confirmed deaths in York County that we've had from COVID-19. And I say confirmed because some of these cases are difficult to link because some of them are test confirmed and some of them are deaths that are clearly related to it. And that doesn't count the other deaths. And there's these unintended indirect COVID-19 deaths that we have to remember. So I also, prior to COVID-19, spent a lot of time working on the opioid issue. And if you take a look at the numbers in our county for overdose deaths, year over year, we're 50% above where we were last year. And I will not say that those people would test positive on COVID-19 and that's what's driven the issue. But when you do necessary things like mandate social distancing, that makes a disease like opioid addiction that much more difficult to navigate. Now, I want to highlight a story. And this is a story of incident command structure, the joy of being a part of a large organization at the same time as being part of public health. When we were ramping up efforts to respond to COVID-19, both WellSpan as well as the York City Bureau of Health developed an incident command structure, and I got the joy of going back and forth between them and learning from both of them. In doing that, we identified some key issues, and being able to identify those issues allowed us to actually pivot a little bit on our work. When you do, as was outlined by the Secretary, contact tracing, case investigation, you get to know those individuals more on a personal level. And my team was making those phone calls every day. It became very clear, 2 lessons that we took away from it. One, where you worked mattered, and that issues related to COVID-19 transmission occurring in the workplace were a significant issue, especially early on. And that for folks in our city, where I have jurisdiction, Hispanic community was being disproportionately impacted. Knowing this was a challenge, we actually had a conversation with leadership from the incident command structure at WellSpan with ours saying, what if we did a pilot doing testing on individuals who are confirmed contacts? Now, right now, we already know if you're a confirmed contact, we want you to go on quarantine. And who more than 6 months ago knew what isolation and quarantine meant? Now we're all becoming experts in it. But we wanted to do testing to expand that window, to identify the cluster or grouping of infections better, and to improve our ability to communicate to patients the importance of isolation and quarantine. And we've been doing that. WellSpan agreed for a pilot, and in these days of really difficult resource restriction, we were able to get 100 tests. And 50% of the individuals that are identified as household contacts tested positive, symptoms or no symptoms. Very, very similar rates to what we were seeing in nursing homes. So what does this do? It's an interesting finding, but what it also does is change the conversation with individuals when we reach out to them. And the conversation changes of, hey, we think it's a good idea to wait 14 days and then do the quarantine and then lead from there to you tested positive, you're at risk for your family and friends in the community around you. Change the level of engagement profoundly. Based on that, we've been able to actually be more effective in our work, get improved engagement in the community, and then also demonstrate my bureau's, I call it the secret sauce, which is we have a fair number of folks who speak Spanish. So when we're calling you up, we're members of the community talking to you versus individuals who may not know you, know where that particular street is, or know your neighborhood as well. And that's the beauty of public health when it's done at its best and most fully supported. So In terms of what we can do going forward, I've seen some interesting ad campaigns talking about masks and different ways to kind of get that message across. But I can tell you it's part of my daily conversation. If you told me 6 months ago we're going to be talking about masking in public, I would have said, I think I saw that in Beijing when the smog was bagged during the Olympics. But that's actually become our norm, and the data supporting it is improving. The reason it wasn't the norm before is we didn't have the data to support it. The studies weren't there. Now the studies are coming, and they're coming pretty clear. It's not like you need to do anything particularly fancy. If you put the mask on, it makes a difference. Every study that's come out that I have seen that has really been reasonably and robustly addressed is supporting that this is a very, very important message. And physical distancing is something we just need to remember. It's not a political statement. It's a reality that we all have to live with if we're going to take care of our friends and our neighbors. Now, I talked a little bit about science. I gave you your numbers, and I talked a little bit about studies. But anybody who knows physicians are doctors, but there are folks who are PhDs who are doctors who know studies even better than we do often. So I'm going to introduce a professor from York College, Dr. Higa. She's a biology professor who specializes in virology, and she can talk a little bit more about the science behind the stuff I just shared with you. So thank you.
Good afternoon. Thank you, Dr. Howie, and thank you for the Wolf administration for the opportunity to speak to all of you this afternoon. I want to also echo my thanks to the healthcare workers and to those essential workers that are risking their lives every day, working with the public and fighting this disease. My name is Maida Higa, and I'm a professor of virology at York College of Pennsylvania. I'm also a mother of school-age children and share the concern of many who would like to ensure the safety of our teachers and students as they return to the classroom. I consider myself lucky in that I'm both able to teach undergraduates and I'm able to do laboratory research with those students, and our research interests lie in better understanding how viruses infect host cells in the body. So I've been following this progression of the pandemic very closely since it arose in January, and I want to use my time today to talk to you a little bit about SARS-CoV-2, the coronavirus that causes COVID-19, and how we can make the biggest impact to reduce its spread. So coronaviruses, as we all know, are primarily respiratory viruses, which means that they're both inhaled and exhaled through our nose and our mouth. When they're exhaled, the virus is released in these droplets, and depending on the droplet size and the projection, they can be carried through the air to varying distances until they land on a surface or another individual. Coughing or sneezing can certainly generate more force or more projection, but research has shown that singing or even just breathing is enough to expel infectious levels of viruses. If we're lucky, those droplets fall to the ground quickly, and if we're not, they may be breathed in by those standing nearby or land on a surface that is later touched and brought back to the mouth or the nose. So to give you an idea of the infectious capabilities of this and other viruses, most viruses are microscopic entities. They're very tiny and they're very easily airborne. And when we breathe in a whopping 6 liters of air per minute. So you can imagine the number of foreign particles, including viruses, that could be brought in by just a single breath. So how do we protect ourselves against something that we cannot see? Well, it turns out the precautions that experts are asking you to use, hand washing and mask usage, social distancing, are based in the known biology of the virus and supported by a growing body of evidence. So first of all, this virus has a fatty membrane that encases it. And this virus is also dissolved. That membrane is dissolved by detergents or alcohol. So if you wash your hands with soap, if you use a high percentage alcohol hand sanitizer, you are in effect destroying the virus. Secondly, these viruses require the droplets that they're encased in to travel and to maintain their ideal environment. So by putting a mask on, any droplets that leave your mouth or nose become trapped and cannot spread. And one of my favorite analogies I've seen compares wearing a mask to wearing underwear. You, among other things, should wash your mask frequently. Don't borrow or lend it to a friend. Wear it the right side out, and most importantly, don't go commando. Remember, your mask protects me, and I wear one to protect you. If you'll indulge me for just one more minute, I wanted to address the anti-science sentiment I've seen in the news and on social media. This virus is new, and as research scientists, we are doing research and analyzing data on this virus at record speeds. We don't always have the complete answers regarding COVID-19, but we do build from what we already know about similar viruses, including other known coronaviruses. So we're not starting from scratch. Many times the data supports the predictions that we've made and how we believe this virus works. Sometimes, though, we get new data that causes us to change our hypothesis and subsequently the advice that we offer on how to prevent spread. And this was the case when data arose suggesting that high viral loads in pre- or asymptomatic individuals were being emitted, and therefore that the result should be to shift to mask usage for everybody. So in closing, I just want to say that the scientific method or the scientific process matters and that science works. We shouldn't be afraid when the data changes and causes us to change our course. That's how science works. Scientists, after all, have the same goal as everyone else: to fight the virus and to have the best chance to keep ourselves and our loved ones healthy and alive. Thank you again, and I'd be happy to answer any questions at the end. Thank you. I would now like to introduce you to Christina Hansen, who is a cardiac intensive care nurse with WellSpan Health.
Thank you, Dr. Higa. So Dr. Higa said, my name is Christina Hansen, and I'm normally behind the lines, not in front of a podium. I work in the cardiac intensive care unit here at WellSpan York Hospital, and for the last 4 months we've been the COVID ICU. But I'm going to keep it brief because I know you're all hot. It's unbearably hot, and actually I'm working behind the lines with all the PPE on every day. Every shift has gotten me used to that heat and humidity, so I got a little advantage on you guys. As a COVID-19 ICU nurse, I've seen a roller coaster of emotions and changes over the last 4 months, but I've also been inspired by the amazing success stories that I've seen in the COVID-19 care of our patients here at York Hospital. One of the patients that we've had a lot that have been in and out of the unit for weeks at a time, but one of our patients who spent several weeks in our unit, on and off the ventilator at times, had moments where we didn't quite know whether they would pull through. Gut-wrenching, heart-wrenching to watch. But our team rallied around this critically ill patient and they made that recovery. Thanks in part to the skilled, caring hands of our nurses, our physicians, respiratory therapists, and our nursing assistants. But COVID-19 has also inspired me about the dangers of the disease from what I've seen in the ICU, and that the ways that the virus attacks the body, as Dr. Higa was speaking of. It has been heartbreakingly unpredictable to see it go after patients with no risk factors and patients of all ages, not just the elderly or those with comorbidities. I've seen people my age and younger struggling with this disease, some not making it. Sorry, I'm a little emotional. Please, please, it is critical that you wear your mask outside everywhere. It's a simple step that can go a long way in protecting others from having to go through what I've seen. I've spent 16 years in our cardiac ICU, which I said before was converted to a COVID ICU, and I've never seen anything like this. My passion and dedication is to my unit, and the successes that we've had in saving our patients is what keeps us going every day. It gives us the motivation to come in every day and put on all that PPE that feels like right about now and sweat it out like this for 12 hours at a time. We will continue to put our heart and soul into caring for these patients, but we need your support. Wearing a mask is a simple way to do your part in this pandemic, and we will continue to do ours. Thank you. I'm going to give it back to Dr. Wolf.
So I got to say, I'm glad Christina's not running for public office. That's just really very good. Thank you. So any of us, and I say any of us, will be happy to take questions now. Any questions? Yes, Dennis.
Senator, you talked, after you opened the state back up, you talked about the targeted mitigation, but
Right.
this recent order to close bars across the state, and I'm thinking, we had a bar owner in Perry County, and says, it's not really an issue here, but my bar's been shut down, and questioning. So if the question is, you wanted to do targeted to the areas that have the problem, why do that statewide thing?
Yeah, this was targeted by function. Unfortunately, the virus is not targeted. We did a really good job in Pennsylvania to flatten the curve. But as we have seen, the virus does not respect state boundaries. So we're paying the price for what's not happening in Arizona or Texas or California or Florida. And the same thing is true across the state. As Dr. Levine said, every county, every region of the, not every county, but the majority of the counties in every region of the state has seen an uptick in cases. And when I say focus, what we focused on is we know that those are coming from places where people are coming together in close contact and where they're drinking. That's bars. And so the order, I think, has really addressed that in a targeted way. The question used to be, red, yellow, green. We're not doing that. We're actually saying, okay, here's where the problem is. That's where the problem is. Let's make that our focus. If we wear masks, that's going to make a difference. Let's focus on that. So there's specific things that we can do. If we don't do this, I keep saying this, if we let it just burn, we're going to get to where Florida is. And that's not going to be good for anybody. Not a bar, not a restaurant, not a business, not anybody. And so we're trying to avoid having that happen by acting decisively, as we did early on, and hope for the same good results.
Do you have specific data that bars are the problem? Is it?
Yeah. Now, I think the Department of Health was somehow taken out of context. We can't tell you. I mean, that has been done where a bar has been identified, and that has created all kinds of problems. I think that was South Korea did that. We don't want to do that. We think that's inappropriate. We have the data. We know this is where the problem is. Are we going to tell you exactly which bar is the problem? No, we're not going to do that.
You're anticipated to veto House Bill 2463 later this week. I was wondering if you were concerned at all that there would be backlash from your own party because it unanimously passed both chambers.
Yeah. You might want to, I'm new at politics. I keep saying this. Numbers are great. What's the bill?
It's the bill that would essentially force the administration to respond to, in process and respond to right-to-know law requests
Right.
during the emergency declaration.
Just for everybody. I am really pro-transparency. When I first took office, I did everything I could to make sure that we were as transparent as open. I don't take my salary. I have a gift ban. I'm doing everything I can for transparency. The practical reality is when you have people who are locked at home in a stay-at-home order and they can't get to the office to actually process right-to-know requests, there's a bit of a lag in terms of dealing with that. So to say, as this bill does, 30 days, down to the details, that's where the problem is. In terms of being open, I'm fine with that. And if I were a legislator, I would have voted for it too, but it creates all kinds of problems. What if people aren't coming to the office? They can't physically put their hands on the things that the right to know actually wants to know. What if that happens? You still have 30 days. Well, that's not a very good bill. I'm for transparency. I'm for doing whatever we can, but I think we need to be realistic about that. If people can't get into the offices to actually look for something that somebody wants to know through a right to know, that makes it really hard to happen. So it's an impractical bill.
But are you specifically or at all concerned about your own party being upset because every Democrat in the legislature voted for it?
As I said, I think that we all have to continually show our support for transparency. I just think this is not a very smart bill. let's do it the right way. If there's something that I can do to improve, I'm all for it. But if you're saying no matter what comes, that was me. No matter what comes, in 30 days you got to have a response. Even if no one's coming into the office, even if you can't put your hands on the evidence that somebody actually wants to physically see, I don't know what to do about that. It won't work. And there are foreseeable circumstances like the ones we've been through when we had stay-at-home orders, where people physically couldn't go in to put their hands on that material. As of over the last 2 months, as that stay-at-home order went away, we've caught up. We are caught up with all right-to-know requests right now, and I think that's important. And I will continue to do that. I'm continued to be committed to that, and I think I will continue to try to explain the details why this is very impractical. Why the first time something comes up that you can't deal with, where you can't get to the office, you're going to break this law. That seems to me to be a bad law. Yes.
Thank you, Governor. What do you say to the establishments, the restaurants, the bars, the breweries who have found sort of a loophole selling a hot dog for $1 a drink, and could they face any consequences for those places?
Yeah, I mean, are there loopholes and ways to do an end run around any piece of legislation or any policy? Absolutely. The key is, I think we just have to keep coming back to the point that everybody here made, and that is, you want your family members, your co-workers, your friends, your neighbors to end up here? And if you don't, then let's try to do the things that is it a frustrating thing to go through if you're a restaurant owner? Absolutely. Or a bar owner? Absolutely. The problem isn't more frustrating to go through what the bar owners and restaurant owners are going through in Florida, where people just not going to come to the bar. I don't care what the states are saying, they don't really care. They're not showing up anyway, and that's going to happen here if we don't do something dramatic. So yeah, I understand the frustration. I understand the desire to try to do an end run around things, but all of us really, that virus is not looking for details here. It's not looking for sort of niceties in the law. The virus is just out to get us, and we need to do everything we can to keep that from happening. Yes?
Governor, on a personal level, what was your reaction to 1,000 new cases today, and also what are your thoughts about how good a job the business community, the bars and the restaurants are doing in the wake of last week's increased restrictions?
Yeah, I think the overwhelming majority of people in Pennsylvania, including business owners of all stripes, are trying to do the right thing. And what I looked at in terms of the numbers is the vulnerability of Pennsylvania. We did the right things. We had one of the best records, one of 3 states, I guess, to have the best record of new cases in the whole country. We were doing a phenomenal job, and let's see where that got us. It got us to a resurgence because other states aren't doing their job. So we need to recognize that we have to do what we can. We've got to do our part. Understanding there's a limit to what that might accomplish, but it's pretty clear that if we do nothing, that is really not going to work. So we're caught between bad choices. There's not a good choice and a bad choice. This is one of those cases where here's a bad choice and here's maybe a less bad choice, but both of these are bad choices. Let's figure out what we can do given the circumstances of that virus that is out to get us. It's very contagious, and we need to do what we can do. Yeah. Oh, sorry.
Pennsylvania's unemployment rate stands at 13%. Labor and Industries is saying that 92% of all eligible claimants who've applied for unemployment compensation have received their funds. We hear, Penn Live, we hear of hundreds, if not thousands, of people who are struggling to make any contact with the UC office in terms of either the chat line, the emails to get their money, and people are facing some really dire situations. Is there something more to be done, something more drastic to address?
Yeah, I think, as you point out, over 90% of the people have gotten paid out. Of that 10% that's left, many of those are areas that may have some extra problems that have led to the extended time frame to get back to them. But having said that, I don't care if it's 10% or 5% or 2% or If there's one person who has not gotten served correctly, that's a problem, and we recognize we have a problem. We have, I mean, I think everybody can see the challenge that all of a sudden, overnight, there was a huge surge in unemployment compensation cases. And we have responded as quickly as we can. It takes some training. We've added, I think we have staff now that's into 1,500. Usually we had 600 in staffing this process before. So we've invested in new technology, and we are continuing to do that. But it goes without saying that if you are one of those small handful of people in the Commonwealth of 13 million who's not gotten served in a timely fashion, or for some other reason haven't gotten served in a proper way, that's a problem, and we're continuing to work on that. Anything else?
Governor.
Oh, yes.
Lebanon County leaders say they're preparing a lawsuit over the CARES Act funding. Is there any intention from your office to release that funding to Lebanon County, or is this something that you guys plan on playing out in the courts, and is this a waste of taxpayer money?
I think we've asked every county. 66 counties went along with all the orders, and it actually worked in Pennsylvania. One county chose not to. They apparently didn't feel they needed the money at that point, and so I think we'll see how the courts rule on this.
You don't plan on releasing that funding, and then do you feel like some taxpayers are out there saying two sides of government fighting against each other, it's a big waste of taxpayer money? How do you respond?
Yeah, well, maybe the county commissioners in Lebanon County should have thought of that when they violated the law. Anything else?
President Trump included Philadelphia among the cities that he said he would send federal agents to. Do you have a reaction to that? Have you thought about?
Yeah, first of all, I didn't know that, but that federal help is not being sought for, as far as I know, by the city. Certainly not by the state. That would be unwelcome here, as it has been in Portland.
Are you prepared to say something formal to him if he?
Yeah, apparently he doesn't listen to me. But yeah, certainly happy to make my opposition to that known. Yes, Dennis.
I just want Secretary Levine, if I could, and
Secretary.
as we're here at a hospital, when this all began, the fear was the hospitals were going to be swamped, and so we stopped elective procedures and other things. What can you tell us about the state of the hospital? I saw in her opening remarks, Roxana said people should still seek health care. Is there a concern some people are staying away from hospitals for fear of, if they don't have COVID, for non-COVID things? And what is the state of Pennsylvania hospitals, ICU beds, that kind of stuff? Are we in good shape?
So we are concerned that people have not sought medical care for chronic medical conditions or other serious acute conditions, and I agree with all the representatives at WellSpan Health that we want people to seek medical care. Currently, our hospitals, our ICUs are in very good shape, and we have no overwhelming of the hospital system. I do want to point out that the idea that the hospital rate is not increasing is incorrect. Actually, the hospital rate of COVID-19 has increased 15% in about the last 2.5 weeks. So we are seeing more hospitalizations. Most of those are in the Southwest. So you can see that things take time. The increase in the Southwest was over the last 3 or 4 weeks. And in the last week or 2 weeks, we're seeing an increase in hospitalizations there. And to anybody who says that the virus is not as severe as it used to be, basically I have one word, and that's Florida. There are 4 counties in Florida that have no ICU beds, and overall the state has about 16% of their ICU beds available. The rest of them are completely full. Areas in Texas, such as Houston, are overwhelming their healthcare system. The same in Arizona. There are concerns in California as well. And so there is no evidence that this virus is less severe or less virulent than it was before. There is perhaps some evidence that it's more contagious, but still that is even controversial. But it does take a lag time before those who are sick, who are infected, get sick, and then there's an incubation period, and then it takes a while for them to require hospitalization and then intensive care, etc. So we're seeing that play out across the South.
Dr. Levine, while you're
Sure.
up there, do you have any reaction to the fundraiser at Bloomsburg State Fair and kind of the controversy going up there?
So I have read about that. My only reaction is that I am going to stay, no matter what happens, laser focused on protecting the public health in Pennsylvania. Our vision at the Pennsylvania Department of Health is a healthy Pennsylvania for all. And I'm going to do absolutely everything I can to achieve that, whether people agree with me or if they don't agree with me. Their health is still important to me. Thank you.
Let me
Sir,
just say one other thing about the, excuse me, just a minute. One other thing about the hospitals. Back in the early days, as you recall, I remember Governor Cuomo of New York talking about the need for tens of thousands of ventilators. I think I mentioned this before. Yesterday we were down to 13%. I think 800 ventilators were being used, or 5,600 or something, and around all the healthcare systems around, and only less than 100 are being used. So we are doing things now. We have testing capacity we didn't have before, over 20,000 a day. We have contact tracing capacity. We know more about the disease. We know that things like masks actually work, social distancing, people are actually doing that. So we know things, and we have capacity now that we didn't have back in the early going that makes it so that we can do things in a much more targeted way. I'm sorry, did you have a question? Oh, you had a question.
I had a question for Dr. Levine, if that's okay.
Dr. Levine, sure.
Dr. Levine, at the USA Today Capitol Bureau, we're hearing reports across the state from family members who have loved ones in hospitals and nursing homes across Pennsylvania, different facilities, different areas, that people, including medical workers, are not wearing masks or proper PPE. I'm wondering how the department will enforce that, and if you are regularly inspecting these facilities again.
So we are regularly inspecting nursing homes as well as hospitals. Actually, I wrote a PPP order for hospitals in terms of N95 masks. And so any nurse or any healthcare provider that is caring for patients with COVID-19, it is required that they have an N95 mask. So we had ordered that. And we're working on the same type of thing in terms of nursing homes. There was a time when PPE was extremely scarce. We do have PPE now. We regularly continue to push it out to facilities. They also get PPE from the federal government and from Health and Human Services as well. What I am concerned about is the national stockpile of PPE, because this was supposed to be, a quiet summer where the entire country was able to store up. Well, clearly it's not so quiet, and particularly in the states that I mentioned. So Florida, Alabama, now Texas, Arizona, California, but of course Georgia, South Carolina, North Carolina now is very challenged. And so that is using up a tremendous amount of personal protective equipment. And so from a national perspective, if we're expecting even a bigger resurgence in the fall, that's possible, we'll see. That's concerning in terms of the ability to, for basically the country and the world to be able to access PPE as time goes by.
Anything else? Yes.
Given the increase of cases in every region of the state, do you have any second thoughts about where the state might go in direction of school reopening in the fall?
Second thoughts. We're meeting.
That there are school districts that are weighing the options.
We're all looking at this with a fresh face every day. And just talked about it, in fact, in a meeting with the Department of Education about an hour ago. The plan is for every school district to make their own decision about exactly how they're going to open. Our guidelines are, we want to keep teachers, students, administrators safe, and if there is a feeling that can't be done, then the schools are going to have various challenges in terms of reopening. One interesting statistic, I think there's an increase of 7% in the number of parents who are opting for cyber education moving into the fall term. In other words, whatever we do from a policy point of view, the goal is to provide confidence to parents and teachers and students. And to the extent we fail at doing that, they will take, parents and teachers and students will take alternative steps. So the answer is we continue to look at this, and yes, there is nothing that is written in stone except that I want to get kids back to school as quickly as possible. Anything else? Oh, that's it? Okay, thank you very much, everybody. Get out of the sun.